The Commissioner for Health and Health Services, Dr. Mustapha Jibril, said though 16 people have been reported dead from symptoms suspected to be of Lassa fever in 3 communities of Fuka Ward under Munya local government area of Niger State, blood samples collected from 5 survivors of the symptoms sent to Abuja Center for Disease Control for examination tested negative to Lassa fever. The Commissioner further explained that the samples were again taken to the laboratory of the Nigeria Center for Disease Control in Lagos, where broader investigation had only one of the samples testing positive. Dr. Mustapha Muhammad Jibril said though no fresh case has been recorded, the state is on alert and in collaboration with the Federal Ministry of Health and Development partners have put in place all necessary measures to check outbreak of diseases.
We also have focal disease control officers, ward disease control officers whom we are also calling for a meeting tomorrow to further sensitize them for them to continue the active search and keep an eye. But we've educated them to stop buying their things, their food stuff from outside, to clean their environment and to ensure that even if there are any other rats in that area, they try their best to take care of it. We have also identified a center in Kakunkoro, right, where if any cases turn up and needs to be quarantined, the patient will be taken there to be quarantined. The staffs who are there have already been trained. I think they've been called down to the general hospital.
Meanwhile, a retreat has been organized for public health workers and community leaders, where the Commissioner for Health and Health Services called on them to educate members of the rural communities on need to avail themselves at health facilities, especially on strange ailments. In Mina, Fatima Usman, NTA News.